Nervous nausea. Nausea from nerves? Are you familiar with this state? Personally, yes. This is exactly how my daughter's reaction to stress has manifested itself since childhood. And personally, I ate the dog on this symptom. I remember how I regularly picked her up from kindergarten, then from school, how they underwent a full examination, lay in the hospital in the gastroenterology department, how the doctors threw up their hands, and after several years of our torment I first heard the correct verdict: "Mommy, your child has psychosomatics, you need to a psychologist." Oddly enough, it was regular visits to a psychologist that began to bring the first positive results quite quickly. Now it doesn't seem strange to me, but then I was very surprised. The fact is that nervous nausea and vomiting occur either as a result of stress or on the eve of an undesirable event, but not everyone is susceptible to such reactions. So why is everyone nervous, but few suffer from nervous nausea? It turns out that for nervous, psychogenic, nausea to occur, there must be a special predisposition. It is more often observed in people who are especially impressionable, with increased excitability and emotional lability, and anxiety. Nervous nausea is more common in women than in men. May be more pronounced during the menstrual cycle. Also, people with motion sickness syndrome, due to a reduced threshold of sensitivity of the receptors of the vestibular apparatus, are more at risk of suffering from this disease. The onset of nervous nausea most often occurs in adolescence, approximately 10 to 14 years, but can begin to appear in early childhood, from about 5 years. As a rule, this is associated with unresolvable, in the human consciousness, tense situations. For example, conflicts in kindergarten or school, for an adult, at work, fear of the teacher or boss, fear of answering at the board, fear of a drunk parent, fear of punishment, fear of condemnation. Psychotherapy, of course, plays a major role in treatment. Yes, this is an absolutely psychosomatic symptom and, accordingly, it is removed with the help of psychotherapy, and in more severe forms, medication is also used. After all, the psychosomatics of nausea is the retention of very strong emotions, resentment, anger, rage. And vomiting is a psychosomatic way of expressing these emotions. No wonder after vomiting relief comes, intracranial pressure decreases, headache goes away. So how does psychotherapy work to treat this disorder? In the therapist's office, the client can respond to these emotions in a way that is safe for themselves and others, thereby avoiding holding on and freeing their body from overwhelming emotions. After all, it is the retention of strong emotions such as anger, resentment, rage that causes nausea, and vomiting is a psychosomatic way of expressing these emotions. And when emotions are reacted, internal tension subsides, easing the person's somatic state. As a rule, such tension can be caused by the same events, the tension in which cannot be resolved in any way. For example, fear of the teacher, answer at the board, conflict with classmates, fear of parental aggression, fear of boss, public speaking, condemnation. Therefore, just reacting is not enough. The task of psychotherapy is to identify this conflict, and help the client feel his resource in order to find the strength to cope with the situation. Finding a resource is the main task of psychotherapy. Without it, a person feels helpless and does not see the opportunity to influence the situation in any way. In the case of therapy with children, it is important to involve parents in the work. Because, up to a certain age, it is parents who are this very resource.